other NSAID. So in that you have paracetamol. So we'll see in a short regarding the paracetamol. So paracetamol and phenytoin. There are two drugs, paracetamol and phenytoin. Paracetamol, phenytoin. So remember, phenytoin is a prodrug. Phenytoin after metabolism in the body is converted to paracetamol. Okay, remember this. Now this paracetamol has a weak anti-inflammatory action. Paracetamol has a weak anti-inflammatory. It is a very good analgesic drug. It is an antipyretic drug, but it has a very weak anti-inflammatory. It has a weak anti-inflammatory action. Now they also inhibit the synthesis of COX. They also inhibit the synthesis of prostaglandin. So they have a weak activity on prostaglandin synthesis. It is a COX. Not effective as compared to other drugs. They are not as effective as other drugs in the inflammation. In the inflamed peripheral tissue, which has a high concentration of peroxide. So this paracetamol is ineffective in the inflammation. Okay. However, it is equally blocks the effect of COX in the brain. It is a selective COX-3 inhibitor in the brain. Remember this, it is a selective COX-3 inhibitor in the brain. It is ineffective in the inflammation because during the inflammation or inflammation in the tissue, inflamed tissue will have a high concentration of peroxide. So it is a ineffective in the ineffective in the inflammation. But it has an antibiotic effect and analgesic. So it can equally block the COX-1 and COX-3 in the brain. That is also responsible for the antipyretic effect. Paracetamol is a potent antipyretic analgesic as compared to aspirin, but it is not having any anti-inflammatory act. It is a routine drug for antipyretic and analgesic act. Now remember, paracetamol is deethylated. It is a deethylated active metabolite of phenytoin. So phenytoin is nothing but the prodrug of paracetamol. Okay, in other words, you can say paracetamol is a deethylated active metabolite of paracetamol. Then what are the adverse reaction of paracetamol? So hepatic and renal toxicity. So paracetamol has a hepatic and renal toxicity. आपने सुना होगा जो पेन किलर ड्रग्स होते हैं वो किडनी खराब करते हैं, आपका लिवर खराब करते हैं. Because most of the NSAID they adversely affect your liver and so in a large dose, particularly in a large dose beyond the therapeutic. So if you take 7 to 10 gram per day, it will produce hepatic damage. It will produce extensive hepatocellular damage and renal tubular necrosis. तो इतना डोज कोई लेता नहीं नॉर्मली. व्हाट इज नॉर्मल डोज 600 मिलीग्राम बीडी और ओडी. तो 7 to 10 ग्राम कोई लेता नहीं है. So that's why don't worry. Okay, it will produce anemia as a result of hemolytic and hemolysis in an individual with the glucose 6 phosphate dehydrogenase deficiency. तो जिस भी पेशेंट में ग्लूकोज 6 phosphate dehydrogenase का deficiency होगा उसमें hemolysis करेगा. और remember, liver toxicity is because of the one metabolite. So liver toxicity occurs with a very high dose. It is due to a toxic metabolite known as N-acetyl parabenzoquinone imine. So remember this metabolite NABQI, N-acetyl parabenzoquinone imine. Okay, so if you take paracetamol beyond the therapeutic dose, or if you take paracetamol in this range 7 to 10 gram per day, so there is a generation of one toxic metabolite of paracetamol known as N-acetyl parabenzoquinone imine, NBQI, that react with the hepatic cell that is toxic to hepatic cell that causes hepatic cell necrosis. That is nothing but the necrosis of liver or cirrhosis of liver. Okay, remember this. Normally, this metabolite is removed from body by conjugation with the glutathione. So you might have seen in the metabolism drug, a second metabolism, glucouronide conjugation, glutathione conjugation. Paracetamol metabolite is removed by glutathione conjugation. So if you take more dose, there is generation of this reactive metabolite, and you know that this metabolite is removed by glutathione conjugation. So you can understand the antidote here only. So those drug, any drug that can increase the glutathione level of the body, that will act as an antidote for paracetamol particularly. Okay. For example, N-acetylcysteine and methionine. These are the sulfur-containing amino acids. N-acetylcysteine, it is a substituted cysteine derivative, and methionine is a pure sulfur-containing amino acid. They are the precursor for glutathione. They are the precursor for glutathione synthesis, and that's why they act as an antidote for paracetamol poison. So याद रखो सिर्फ एंटीडोट क्यों है, कौन सा है, ये याद नहीं रखना है, क्यों है वो भी याद रखना है. So N-acetylcysteine and methionine are the specific antidote for paracetamol overdose or paracetamol poisoning or paracetamol intoxication. Liver damage is because of this metabolite N-acetyl parabenzoquinone imine. Okay, remember this. Now we'll see the next drugs. Next drug are nothing but the pyrazolone derivative. Pyrazolone derivative. In that you have different drugs like and aminopyrine, antipyrine, phenylbutazone, oxyphenbutazone, etc. So these are nothing but the pyrazolone derivative. Okay, pyrazolone derivative. So example aminopyrine, antipyrine, phenylbutazone, oxyphenbutazone, and other drugs like phenyl dimethylpyrazolone, that is known as analgesic. These are the pyrazolone derivative. Remember this oxyphenbutazone is a prodrug of this phenylbutazone. Phenylbutazone is a potent anti-inflammatory agent, but it is a rarely used because of its adverse effect. GIT irritation, hepatic and renal damage, fatal hematotoxic. The next drug is oxyphenbutazone. It is an active metabolite of phenylbutazone. It is an active metabolite of phenylbutazone with the same side effect and effects. Then an analgin is also potent analgesic and antipyretic drug, but similar kind of side effects will be there in case of analgin. So these are the pyrazolone. So obviously they are used as an analgesic, anti-inflammatory, and glucosphoric drug. Next category is known as indole derivative. So you have indomethacin over here. Indolactic acid derivative. Indomethacin has a anti-inflammatory, analgesic, anti-inflammatory, and analgesic properties. It reduces the swelling of joint, bring quick reduction in the joint swelling in the arthritis, particularly useful in the acute attack of gout. Gouty arthritis means का use है. What are the adverse reaction? Main adverse reaction. Remember, this was already asked in this. Frontal headache. Frontal headache is the adverse effect of your indomethacin. Other adverse effects like mental confusion, blurring of vision, depression, psychotic disturbances, and that's why this your indomethacin has a adverse effect of mental confusion, then blurring of vision, depression. Okay, and that's why this drug is contraindicated in the workers who have to perform delicate work, and this drug is also contraindicated in the drivers. तो ऐसा नहीं होना चाहिए कि आप जा रहे हो ट्रिप पे, ड्राइवर ने लिया इंडोमिथासिन ले लिया और उसको हो गया मेंटल कंफ्यूजन और डिप्रेशन, और उसने ठोक दिया गाड़ी, आपका तो विकेट गिर जाएगा. तो इसलिए फ्रंट दिस इंडोमिथासिन इज अ कॉन्ट्राइंडिकेटेड. इट इज अ कॉन्ट्राइंडिकेटेड इन द machinery operators and drivers. Contraindicated in the machinery operators drivers because of the producing mental confusion and blurring of vision, depression, etc. They are also contraindicated in the psychiatric patient and patient having epilepsy, history of epilepsy. जिसको epileptic attack आता है तो उसमें भी ये यूज नहीं करें. Kidney disease, pregnant women and children. Also contraindicated in the patient having kidney disease. Also contraindicated in the pregnant woman and children. Indolastic acid. It is a rarely used drug nowadays. Its use is only restricted to gout. Okay, it is used in the acute gout and alkaloid spondylitis. Sulindac, a derivative of indomethacin. Sulindac is a fluorinated derivative of indomethacin. It is a prodrug and has a longer duration of action. These are the important points from this. Now we'll see the next category. Next one is a heterocyclic arylacetic acid derivative. If you see the reference book, they have mentioned a lot of information regarding each category, but each and everything is not important for GPAT. So I am highlighted over here only pinpoints for GPAT. So this time in this arylacetic acid derivative, you have diclofenac. Diclofenac is there. Then this diclofenac has a greater sustained activity than indomethacin, naproxen, and other NSAIDs. The adverse effect includes gastric irritation. It will cause hyperacidity. That's why this diclofenac is combined with the either ranitidine or your omeprazole. And diarrhea, headache, dizziness, skin rashes, blood dyscariasis. These are the adverse. It is mainly used in the rheumatoid arthritis. Remember, mainly used in the rheumatoid arthritis, severe osteoarthritis, and alkaloid spondylitis. Then derivative of diclofenac known as aceclofenac. It is a highly selective COX-2 inhibitor and is converted into one active metabolite known as a 4-hydroxyaceclofenac. The metabolite 4-hydroxyaceclofenac. It increases the cytoperative hexamine level in the stomach, and that's why it will not produce hyperacidity. It will not produce GIT ulceration. Then next one is a ketorolac. Ketorolac. It is as effective as morphine in the relief of pain. It is a highly promising painkiller drug. Ketorolac mostly used in the orthopedic practice, orthopedic pain and chronic cancer pain. Okay. So as effective as morphine and used in the orthopedic pain, cancer pain, like other NSAID. Like other NSAID, it also inhibits the platelet aggregation. It has a less, and now next drug is a tolmetin. Tolmetin is again rLastic acid derivative, looking similar to ibuprofen and its action and adverse effect. Analgin. Analgin can cause agranulocytosis and indomethacin, and this analgin can cause agranulocytosis. Diclofenac and indomethacin can cause aplastic anemia. The next category is a propionic acid derivative like ibuprofen, then naproxen, phenoprofen, flurbiprofen, ketoprofen. They are nothing but the analgesic, antipyretic, and anti-inflammatory drugs. Properties of there are similar to aspirin, but they are better tolerated. Adverse effect क्या इनके gastrointestinal disturbances, nausea, vomiting, pain, epigastric pain, then a fullness of sense of fullness in the stomach, then heartburn, etc. So they are used in the rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis. Particularly, this flurbiprofen is used in the ocular inflammation. So it is used as anti-inflammatory drug for ocular inflammation. Flurbiprofen. Remember, there was a question regarding this on GPAT. Flurbiprofen is an ocular anti-inflammatory drug available in the eye drops. Then ibuprofen is the most tolerated drug among this category. Ibuprofen क्या है इसके इसमें सबसे ज़्यादा tolerate करती है. So we'll see the next. I think this will be the last slide for today's chapter. Don't worry, we are going to see same chapter from medicinal chemistry point of view, and we'll also cover whatever we have completed drug acting on CNS from medicinal chemistry point of view. So medicinal chemistry की देखेंगे. Phenamids. So other NSAID phenamid. Phenamids or phenamic acid derivative. So in that you have two drugs, mefenamic acid and N-phenic acid. Mefenic acid is an anthracic acid derivative useful in the chronic and dull itching pain. Now this drug is mostly mostly used in the menstrual bleeding to treat dysmenorrhea. It is mefenamic acid and fluphenamic acid. These are the two drugs. They are mostly used in the dysmenorrhea. They are also used as an antispasmodic. Next category is known as oxycam. In that you have piroxicam, meloxicam, tenoxicam, lornoxicam. All these are the preferential COX-2 inhibitors. Their adverse effect indication are similar like previous class. Then next class is known as selective COX-2 inhibitor. Selective COX-2 inhibitor. All the COX-6, celecoxib, rapocoxib, these are the selective COX-2 inhibitors. With that, we'll see what are the preferential COX-2. Preferential COX-2 inhibitor, they will inhibit COX-2 more than COX-1. For example, nimesulide, meloxicam, nabometone. So out of this, nabometone is a prodrug. It is converted into active metabolite known as 6-methoxy-2-naphthalenic acid. 6-methoxy-2-naphthalenic acid. Remember, it is a metabolite of your nabometone. Then celecoxib, refacoxib, then valdecoxib. All these are the selective COX-2 inhibitors. Last two, refacoxib and valdecoxib, are longer acting. They are used as analgesic anti-inflammatory in the osteoarthritis and rheumatoid arthritis. So these coxibs are very good analgesic drug, anti-inflammatory. Most of them are they are not used because of their adverse effect. You see it. Celecoxib is a contraindicated in the patient with allergy to the sulfonamides. जिसको सल्फोनामाइड का एलर्जी है उसमें सेलोकॉक्सिब नहीं देना है. Hemoslide has a nephrotoxicity and hepatotoxicity. That's why it is banned in the almost all countries. To one adverse effect known as a dominant hepatic failure. Hemoslide has been banned in the several countries due to dominant hepatic failure. And refacoxib and valdecoxib has been reported to be associated with the increased risk of myocardial infarction. That because of that they has been withdrawn from market globally. That's why most of these coxib will have adverse action on the cardiovascular system. Out of this, paracoxib is a product of valdecoxib. If you want to read additional information regarding this, you can read from reference book. Whatever is important for GPAT, I have already. You can see over here the drug used in the rheumatoid arthritis. पर भी classification है पर revise करेंगे उसको. Drug used in the rheumatoid arthritis. Anti-rheumatic drugs. So in that you have main two class. First one is known as disease modifying anti-rheumatic drugs, MRDs. Disease modifying anti-rheumatic drugs. So in that you have two subclasses. Non-biological drugs, that is synthetic drug. Biological drugs means biological drug means whatever the chemical synthesized inside body itself. The non-biological drug In that you have first immunosuppressant. They will suppress the immunity, will prevent the inflammation and pain. Methotrexate, Z, azathioprine, cyclosporine. All these are used as anti-cancer drugs. Anti-cancer drugs or immunosuppressant. Also used in the anti-rheumatoid arthritis. तो क्या है वो? What happens in the rheumatoid arthritis? Rheumatoid arthritis में क्या होता है कि आपका जो joints होते हैं, joints में your body will treat your joints the foreign, and in against that your body will produce antibodies. Your मतलब आपके बॉडी आपके जॉइंट्स में जो केमिकल्स होते हैं साइनोविल फ्लूइड एंड उसको एंटीजन बोल के ट्रीट करती है, उसके अगेंस्ट में एंटीबॉडीज बनाती है और वहाँ पे एंटीजन एंटीबॉडी रिएक्शन होता है, पेन इन्फ्लेमेशन स्वेलिंग वगैरह होता है to suppress the immunity because it is a immunogenic disorder. So to suppress the immunity, these drugs are used. Alpha-salicin is also used. The uricosuric drug to decrease the uric acid. Chloroquine and hydroxychloroquine. These are the anti-malarial drug, and they will also have anti-rheumatic. Phenoamide is also drug. Biological agent में आता है आपका tumor necrosis, tumor necrotic factor inhibitors. In that you have monoclonal antibodies. Interleukin 1 antagonist is also there. That is anakyra. And monoclonal antibodies. They are this tumor necrotic factor inhibitors. This is an anti-rheumatoid drug, and next one is an anti-gout drug used in the treatment of gout. इसमें क्या होता है gout में? So your uric acid level is increased. That uric acid combines with the cations present in the body like sodium, potassium. Crystal get deposited into joints that causes pain and inflammation, swelling, etc. Drug used in the acute gout, normal analgesic antipyretic like NSAID, then colchicine and glucocorticoids. Colchicine, glucocorticoids, and normal NSAID. They are also used. Then in case of chronic gout or hyperuricemia, uricosuric drugs. Those will increase the excretion of uric acid. So those drugs are used. For example, these probenecid and sulfenpyrazone. These are the uricosuric drugs. They will increase the uric acid excretion. Another is known as a uric acid synthesis inhibitors, so known as a allopurinol. So it is a xanthine oxidase inhibitor. Allopurinol is xanthine oxidase inhibitor. So that xanthine oxidase enzyme is involved in the metabolism of your nucleotides and synthesis of uric acid. So that uric acid अगर synthesis कम होगा, obviously gout का problem कम होगा. So these are the drugs used in the inflammation, pain and related. So वो chapter finish हो चुका है आपका, और we'll see the same chapter from pharmacology point of view in the tomorrow morning.